Hello, everyone. Thank you so much for joining this program today. This is the program focused on African women's health, a program that is committed to promoting African women's health at home and abroad. In case you are joining us for the first time, we share the global message of health for all and emphasize that African women must not be left behind in optimal health. My name is Dr. Olayide Ogunshiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. Last week, we continued our discussion on an important women's health issue, female genital circumcision, and we specifically looked at current practices of FGM among practicing communities, as well as the ongoing global attention at eliminating the practice. The plan for today is to round up our conversation on that topic by bringing you some empirical findings from studies that were conducted among Australian midwives and women living with female genital mutilation in Australia. We explored the knowledge level and attitude of Australian midwives, and through semi-structured interviews among 11 Australian midwives practicing in Western Sydney, New South Wales, Australia, we identified a significant knowledge gap among midwives, especially as it relates to FGM and its legality in Australia. In terms of the attitude, the Australian midwives' attitude reflects that of the international community, that FGM is an unnecessary practice that affects women physically, emotionally, mentally, and gynecologically. The 8 issues that the midwives identified among the women living with female genital circumcision include ruptured bladder, difficulty passing urine, urinary tract infection, trauma and pain, as well as severe difficulty in terms of childbirth. These midwives reported female circumcision as a complex obstetric issue, and that the major challenge is that of managing those health issues. They mentioned the main approach they used in managing the women, and what they stated was that the major approach that they use is defibrillation, which is increasing of the passage so that the baby is born safely through the birth canal. They, however, did not mention how they promote comfort for women living with female genital circumcision whenever there is need for vaginal examination. Now, in terms of the African women living with female genital circumcision in Australia, in their own responses, about 40 of them responded to survey questions, and all of them confirmed that they were aware of the reason behind female genital circumcision. They confirmed their experience of one negative health consequence or the other, and they clearly indicated zero tolerance towards female genital circumcision. And having said this, the next thing that you will want us to consider is, what are the take-home messages from all that we have said today with regards to female genital circumcision? Number one is the fact that the study among Australian midwives revealed significant knowledge gap. Yet, these are the midwives that will be caring for women living with female genital circumcision. What that just tells us is that there is need for increased awareness. There is need for more education. There is need for more opportunity to share information about female genital circumcision among Australian midwives and other midwives caring for women living with female genital circumcision in many other Western countries. It may be important to mention at this stage that World Health Organization have got some clinical guidelines and manuals, and they have published some books that can support midwives and other healthcare providers in managing women and girls living with female genital circumcision. Please, I encourage you to check World Health Organization website, and you'll find some of these publications there. Number two, take-home message is that having Australian midwives as well as African women living with female genital circumcision confirming the negative consequence of female genital circumcision suggests that there is need for concerted effort for the elimination of this particular practice. Some of the publications that came out of the studies that I've just finished speaking about are provided, and they're available on the internet. I provided links to these publications. Please have a look at some of these publications for greater details on the discussion that we have had today. Please share this particular video, watch it, and like it. Next week, we will be bringing our conversation. We'll be focusing on fibroid, uterine fibroid, commonly referred to as fibroid. And I really look forward to next week when we shall meet again. Meanwhile, I want to say a very big thank you to you for being there with me today. Thank you for listening. Thank you for watching. In case you are wondering who you are watching through this video, my name is Dr. Olaide Ogunshiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. So until next Monday, when we shall meet again on this program focused on African women's health, I want to thank you again, and it is bye for now.